Ladies and gentlemen, I'm now about to present to you our guest of honor. She has been the first woman in India to have joined the officers' ranks of Indian Police Services. In fact, she has served over 35 years and has been the former Director General, Bureau of Police Research and Development, Government of India. She has served as the police advisor to the Secretary General of the United Nations in the Department of Peacekeeping Operations in New York, the recipient of Ramon Magsaysay Award, which is known as Asia's Nobel Peace Award for bringing a positive relationship between police and the people. I am talking about the one lady who has been a role model for so many of us. She has been voted as the most admired and trusted lady in India by Reader's Digest, The Week magazine, and many others. May I request all of you to please put your hands together and welcome on stage a teacher, a mentor, a social reformer, an author, and so much more. Please put your hands together and welcome on stage our guest of honor, Dr. Kiran Bedi, Honorable Lieutenant Governor, Government of Puducherry, India. We are honored and humbled by her kind presence, and I think this is an evening for us to celebrate.
Okay, friends, I've been rushed into it. I've come all the way from Puducherry for a reason, friends, because I owe the life of my father to the medical profession. I recall when I was only 6 years old, and my father had a very severe fatal accident. He was on a mobike. We were from Amritsar, and he was on a mobike on a Sunday, and a jeep came, bashed him up, threw him down on the road, and just ran away. But somewhere the people shouted at the jeep and said, "What are you doing?" It was a hit and run. They caught hold of the jeep. They made sure my father's removed to the nearest hospital called Vijay Hospital in Amritsar. I was only 6 years old at that time. I still remember how my mother went barefooted running from home to the hospital when she realized, and she just ran, and we young sisters, me and my younger sister, 4-year-old, we ran behind my mother. But when we reached the hospital, my father told the doctor there, "Call Dr. So-and-so. He is my tennis friend, and if he comes, I'm safe." And fortunately, that doctor was available at that time in the hospital, and he came. He told my mother in my presence that if he survives for the next 24 hours, he survives, otherwise not. And my father said, "No, if I'm in your hands, I will survive," for my 3 daughters. We were 3 of us at that time. So every time, friends, I get an invitation from any medical conference or group, I never miss it, because I come back to express my gratitude to this medical profession. Imagine if I had lost my father at the age of 6, and this doctor had not taken care of my father, I would have been probably not here today. I wouldn't have been here today. So therefore, and the second time again, when I was posted in the Northeast, and it was a very bad operation we went through, and it's a faraway area. He was choppered back to Delhi, straight to the AIMS, and how Dr. Mehta at that time rescued his life once again, which gave him a lease of 20 years of life. I value every day of that extra life my father lived, all because of all of you present here. Once again, want to thank you on my behalf, my family, that your profession saved him. I want to congratulate all your award winners, which I believed you're going to be winning plenty of awards. And I thought I would be part of the ceremony, but I believe it's going to be after this few words. I have something to share with you. What I notice as an administration responsible, as a public servant working in Puducherry, is that we got so many hospitals. We got hundreds and thousands of medical college students. But they don't step out in the field. Whereas every inch of it could be covered. Why should we not have medical college students, medical college teachers, medical college doctors step out on the weekend? Why not? I still wonder. I think there's a need, friends. I'm not in here to lecture. I'm only here to share with you my observations of the medical profession. that why do we hold back students on the weekends? Please get them out on Sundays. There's no Sunday for a medical doctor, like there's no Sunday for a police officer. There's no Sunday for doctors. If you're looking for a weekend job, then you need something else. But this is 24/7 work. You've asked for it. We've asked for it. And if we are going to switch off our phones on Sundays, switch off on Saturdays, and say, I'm not available, I think please choose a different profession. You're not there in the right profession. Because somebody in emergency, you may have an attendant looking at your phone, at your message. So why should a student get used to a Sunday or a Saturday from day one? Why should students and their teachers step out, adopt certain areas, and do what? I can have an idea for you to do what. But convergence of these kind of early medical education to be linking with the common person, with the community, is critical as a soft skill from the very beginning. But if they get cocooned and timetabled and say we go after 5 years, or when we'll do field work, or go to the rural areas unless it's compulsory, I think there's something initially wrong. Get into community orientation from day one. I'm very grateful, and I notice as a Rotarian and otherwise how you all doctors go for camps. You do individual services with Rotary and Lions clubs and many, the JCs, the Rotary, many groups which you all go to, the roundtablers. All of you are very well associated with individual causes, which I think is very creditable, because the proportion of doctor to population is still not up to the standards, nothing compared to the developed world. So therefore, the only option is to reach out to the people through these kinds of organized societies and institutions. I recall my tenure as Inspector General Prisons, when I had 10,000 prisoners under my charge. And you know, prison is a very unhealthy, psychologically and physically, basically an unhealthy institution. Physically, because many of them are alcoholics, they're also addicts, psychologically under tremendous pressure, all kinds of ailments, tuberculosis very high. And I had only one doctor at night for 10,000 prisoners. At that time, the government could not afford to give me more than one doctor, just one doctor. Today, there are many, and things have dramatically changed. But I'm ancient, so the time was when I had only one doctor. And if there's anybody dying that day, I would have lost my job, because they would have said, this is death in judicial custody. Friends, I survived because of you. All of you would, I remember the doctors in Delhi would come as groups, 26th January, 15th August, festivals, they will all come as a group. And all of them, we used to hold camps in the jail prison. On my request, the Indian Medical Association came, and I cannot thank them enough, because they came, they gave a health card to the patients, and they came as camps. I think that is what survived it. The children didn't have a pediatrician, and their heads were bloated when I took over. We didn't even have a pediatrician. We didn't have a child card. A pediatrician, Dr. Arora, who's no more, but is mentioned in my book, he came and offered help. How much of your voluntarism actually saves life and restores health back to the people? I cannot thank you enough, because you and I have been collaborators at work, whether it was in my prison work or elsewhere. So friends, I was to say, it's very important to continue to converge till we improve in our scale. I don't even know whether we have one doctor to 1,000. When there are so many, even to 10,000, God knows, the scale is so low. So it will take us a long time to cover up this gap. So till then, we'll have to continue to volunteer. Convergence of not only services. I have seen many dispensaries, government dispensaries, close at 2 o'clock. Why should an infrastructure close at 2 o'clock? Why can't it be going over to another practitioner doctor who could take that expensive infrastructure and run a dispensary? So I think these are the policies the Indian Medical Associations could take up with the new health doctor, Dr. Harshvardhan, saying wherever you have an infrastructure which closes at 2, why can't it be given to a practitioner who may like to practice from 2 to 10, where it connects with the labor force, which comes back after 7 o'clock. So I think we have existing resources which we are not fully utilizing still. On convergence, I also feel that we need to converge with Ayush. We need to converge with other disciplines. Many disciplines have better solutions. And I give you one more example from my professional life. As a police officer, when I saw drug abuse and domestic violence and crime very interrelated, I started drug abuse treatment centers as a police officer in my police station premises. And what happened? While we had the allopaths coming in, we brought in the homeopaths. And the homeopaths also played wonders in our treatment because they were recovering the fact that doctor was checking them up, and even homeopathy worked. They could sleep well, they could handle the body withdrawal symptoms, and they could come back, get back their appetite. I've experimented with both. I'm not speaking through non-experimentation. I've worked in the field of drug abuse treatment as a volunteer, as a foundation for 12 long years, much ahead of time when there were no treatment centers. This was much ahead of time, and I did it to prevent crime, and it did help. So convergence that's why the government of India has come up with Ayush. If you believe, and if you think there's an option better, why not offer it? Offer it to the patient, say, try this as well. And if it's combination is possible, if not possible. Because in the end of the day, medical profession is there to save a life, rescue life, restore health. So I would think that I have experimented, it worked. And I do remember, I dare say, that when I was trying yoga and homeopathy in the 90s on drug abuse patients, there were a vested interest which questioned, why am I doing this? I said, because I cannot afford expensive medicines. And number two, those medicines are equally dependent drugs. So they would be, and some of them are already bad. Like it was Proximon and diazepams. They are all banned. They're psychotropic substances. They fall almost in that category. So how can I bring in those drugs? So therefore, I tried homeopathy, but it was a fighting back a vested interest. And I'm so glad the acupressure, the homeopathy, the Ayurveda, and the other disciplines, if you all believe in, I think we need to be aware and not be antipathy, but collaborative. And if we have a solution, please let it be allowed to be used. One thing more on, I think I've said most of these things as relief to millions. I came across a very interesting TED talk on this medical, which I thought was so good, so important for this very latest TED talk on medical. It says, a redesign of what today is an idea for you, friends. A redesign of what today is a sick care system into a true health care system. At the moment, we are mostly on sick care system. If we can redesign it to a true healthcare system that focuses on prevention and behavioral changes, requires such as systems like regular checkups, mandatorily telling your patients, come for it, or your friends or people, come for a regular health checkup, come for a monthly checkup, come for a second monthly checkup, to detect anything coming into the DNA or any cell trying to become cancerous. Detected much earlier than even the first stage, so it might be better. So it's true healthcare systems like regular health checkups, practice of yoga, practice of meditation, weight control, stress management, healthy food habits, clean environment, and also important clean character habits. That focuses on prevention, as I mentioned, and behavioral changes, which I talked about, which requires every actor in the system to change. It requires the political willingness to shift budgets and policies towards prevention and health education, to design a new set of financial and non-financial incentives. Insurance does. If you're a healthy person, insurance charges you lower premium because you are disease-free. It raises it if you have other issues. So that's an incentive for better health management. So towards prevention and health education, to design a new set of financial, non-financial incentives. It requires creating a regulatory framework for the gathering, using, and sharing of personal health data that's at the same time stringent and sensible. It needs doctors, hospitals, insurers, pharmaceuticals, and medical companies to reframe their approach. And most important, it can't happen without the willingness and motivation of individuals to change their lifestyle in a sustained way to prioritize staying healthy, in addition to opening up for sharing the health data on a constant basis. Many of our constant movements like Pink Days and diabetes prevention and Cancer Prevention Day and so many children, these are all great prevention movements. We need to continue to spur them, continue to support them, but get back to individuals to say, come for an, मैं तो सब ठीक हूँ, मुझे कोई problem नहीं, कोई बात नहीं, check up कराओ. So you can detect something very early and then start nipping it then. That means you promoted a healthcare style. You preventive rather than somebody who's coming for a whole huge of transplantation. This change, my friends, may not come overnight, as the talk says, but by refocusing the incentives within the healthcare industry today to actively keep people healthy, we may not only be able to prevent more diseases in the first place, but we may also be able to detect the onset of certain preventable diseases earlier than we do today, which will lead to longer and healthier lives for more people. Most of all, most of the technologies, my friends, that we need to initiate that change are already existing today. But this is not a technology question. It is primarily a question of vision and will. You are here for the Doctor's Day to give more ideas, to take this vision for the next 10, 20, 30, 40 years. You are here not for today, just for today. You all are, and we all administrators are here to provide a vision, a direction, sow the seeds so that others may bear the fruits. So friends, I take it that this Doctor's Day which you're celebrating and this congregation will work more and more towards convergence of all verticals of medicine, also bring the students out right from one day, teacher-led campaigns, supporting public campaigns, which I've noticed the clubs, many institutions do, and also, rather than from a sick care system, as I said, to a true health care system, where you advise people saying, very low fee, come and do a monthly. Just come and say hello to me. I'll check your BP, I'll check your blood, I'll check your blood sugar, I'll check your other things so that things are ordered, so that you are leading a healthy life ahead. Detection of any onset can be prevented. I think if we can take this Doctor's Day conference towards that, I'm sure with Dr. Harshvardhan in place, who's open to newer ideas, and the government of India and of the present, which is looking for more ideas, will certainly respect yours. Thank you very much and wish you all the very best.